Welcome to the UK Made Easy podcast, where we help aspiring international medical graduates like yourself achieve their dreams of passing their PLAB 2 and practicing medicine in the UK. Hello and welcome to yet another episode of the UK Made Easy podcast. My name is Seif, and in this episode we're going to listen to a very interesting recording about a role play that I've done with one of our candidates. The theme of this scenario is safeguarding in general and domestic violence in specific. So as you already know, domestic violence is one of the things that are taken very seriously in the UK because we are safe doctors and we need to make sure that our patients are living in safe environments. But your job becomes a little bit more complicated when there is a pregnancy involved in the situation. In this scenario, we're going to explore exactly how to tackle these sort of scenarios, what are the things that could be commonly missed in a scenario like that, and how to avoid them. After we listen to the scenario, it's going to be followed by a detailed feedback that I had for our candidate. Thank you very much for tuning in, and I hope you enjoy today's episode.
Okay. Hello, how are you?
I'm good. Thank you, doctor.
Okay, so let me introduce myself to you. My name is Dr. Mohammed, and I'm one of the junior doctors here in the emergency department. Can you please confirm to me your name and date of birth?
My name is Alicia, doctor, and I'm 28 years of age.
Okay, perfect. So please, can you tell me what brought you to the hospital today?
I'm really worried about my baby, doctor.
Okay. I'm so sorry to hear that you're worried about your baby. But can you tell me more about that? Like why you're worried about your baby?
Of course, I'll tell you more about that, and I'll tell you everything that you want to know. But can you tell me if my baby's okay? I'm really worried, doctor.
Yeah, I understand that you are worried now, and I'm here just to go through all the information that will make me in a better position to tell you that you are safe and your baby is safe. So can you please tell me exactly why you are concerned about your baby?
I'm concerned about my baby because I woke up this morning and I found some blood from my frontal passage, and I'm really worried about my pregnancy, doctor.
Okay. So yeah, I'm so sorry that you have that symptom. And please, can you tell me how far you are now in your pregnancy?
12 weeks.
12 weeks. Can you tell me more about that blood or the bleeding that you found in your front passages? Like when exactly it happened?
I just told you, doctor, it was this morning.
So it was this morning. So that was the first time you noticed that? Like it didn't happen before?
No, that's the first time, doctor.
Okay. So can you tell me like what were you doing?
I was in the bathroom, doctor.
Okay, so you were in the bathroom. So did you fall down in the bathroom or hurt yourself by any means?
No, doctor.
So it just like you noticed that blood spontaneously, right?
Mm-hmm.
Oh, okay. Okay, so do you follow up your pregnancy? Do you go to your GP or antenatal clinic?
Yes, I am regular with it, doctor.
Okay, perfect. So when was your last time you went to the antenatal clinic?
I don't really remember, doctor, but I'm very regular with my timings.
Okay, so do you remember your last ultrasound if it was normal?
Yeah, it was normal. There was no abnormalities, no, doctor. It was okay.
Okay. All right. So please, can you tell me with whom you're living right now?
I'm living with my partner.
Are you living
doctor.
by yourself?
No, I'm living with my partner.
With your partner?
Mm-hmm.
Okay, good. It might sound like a little bit intrusive, but I want to know more about your relationship with your partner. Is that okay with you?
Yes, doctor. What is it that you want to know?
Okay, perfect. How long you have been with your partner?
Oh gosh, it's been 7 years now.
Okay, perfect. 7 years. All right. Do you have any kids?
Yes, I do. I have a 3-year-old daughter.
Okay, and how she's doing?
She's fine, doctor.
Okay, perfect. So is your relationship with your partner going okay? Are you guys getting along together?
Yeah, we're doing just fine, doctor. Thank you for asking.
Yeah, I understand, Miss Alicia, that you're here for your bleeding from your frontal passage. But I want to ask you more about some bruises and fingerprint on your right wrist that one of my nurses told me about. So can you please tell me, like, why you have that bruise on your right wrist?
Yeah, I just banged my head, my hand against the wall, doctor. It's nothing. Don't worry about it.
Well, I'm just here to, to help you. I really want you to be safe and your baby. So is that right wrist bruise related by any means to your frontal passage bleeding?
How so, doctor?
Well, I just want to know more about your relationship with your partner, because it's common that if there's any physical violence or anything, it might lead to the case that I'm seeing now. I'm not saying it is the case with you, but I just want to help you. That's why I want to know more about the situation that you are experiencing in your house with your.
Well,
And whatever you say.
Yeah,
Yeah.
It's really embarrassing, doctor. And yeah, well, thing is, I had a fight with my partner this morning, and yeah, he just grabbed me by the arm. But thank you for asking, but it's nothing that you should worry about.
Okay. Have you talked about this to anyone, like one of your family members or your friends? Have you talked about this at all?
No, doctor.
Okay. Is it the first time like he's doing like that with you?
Yes, it's the first time, doctor.
Okay. Okay. So how he's dealing with your other daughter?
No, everything is fine, doctor. He just lost his temper. That's all there is to it.
Okay. So I understand your concerns now, Miss Alicia. And what I think is safe for you and the baby now is we are going to have you in our hospital. I will consult my seniors to reassess you. And, the violence at house is very common, and there's nothing to be embarrassed about it. But for the safety of the baby and for the safety of you, we can have like more things to be done, and we have so many resources to help you. And this is not, I'm saying like you and your partner will be apart, but we will give you exactly the plan that you need while you are with us, and to run more investigations on you and the baby to make sure that everything is okay. Does that sound right for you?
Well, I appreciate what you're trying to do, doctor. I really do. But and like I said, I don't think it's something that...
Want to put your PLAB 2 knowledge in action and receive detailed feedback about your strengths and areas of improvement? Order the UKME Easy Mock service, where we don't only tell you how you did, but actually provide you with pointers on how you can improve fast. Head over to www.ukmadeeasy.net/book-online. That is www.ukmadeeasy.net/book-online.
Okay.
Yeah.
You see, the reason that I'm asking is that I have like a very interesting impression about you. The thing is, I love the way you yourself, like you handle yourself. You're very confident, right? And you come as assertive, yet you show empathy, which is amazing. And it made me kind of think, like, this doctor must have practiced somewhere where he had to talk in English. And I was like, this is very impressive. But the thing is, I'm going to give you like a whole perspective about the station that we did. So basically, it's a domestic violence station.
Yes.
Like I said, I like the way you hold yourself. I like your confidence. I like the fact that even though you're confident, but you do show empathy in a very nice way. And I'm particularly impressed by how you brought up the whole idea about the domestic violence. Like, what you did is not like, all right, let me reiterate what I just said. We do practice with
I'm so surprised about, I'm so sorry, I'm so happy about what you said, but I'm still so surprised because I felt like I did horrible in the all 5 stations.
I'll give you the detailed feedback. All right, I promise. Okay. All right, so just hold your horses. We'll come to these questions, and I'll answer everything that's on your mind. Okay. Yes. Now, what I'm saying is that you have the approach and you have the interpersonal skills that are needed for this examination. yes, you did miss a lot of things. Okay. Now, to be perfectly honest, and I'm going to highlight those for you. But
Yes,
again, what I see is that with some studying and with more practice, you're going to be a star. That I can promise you. Okay.
perfect.
So, what I want you to focus on from now on for the time being until your examination. When is your examination, anyways?
October 22nd. It's so near.
22nd. All right. I want you to focus on your medical knowledge, so to speak. All right. So if you are studying from the source that you just mentioned, read those like scenarios again and see exactly what are the things that you cannot miss. And I'm going to highlight them for you so that you understand. Okay. Now, first thing that you said, I am one of the doctors in the emergency department. That wasn't in the emergency department. It was in obstetric and gynae. Let me share the screen with you so you can see it again.
Yes.
All right. So it says you are F2 in OBG. Okay.
Yeah.
Make sure that you know what setting you are in, because that's a fatal mistake. If you say that you are in an emergency department where in reality you are not, that's a big problem. Okay.
Yeah.
The safest way.
I was thinking like I'm seeing the different screen and it's taking my mind. But of course, in the exam setting, while I'm seeing it before going inside the room and I'm reading that paper on the front, I won't be doing that. But yeah, thank you. Of course, it's a fake.
I'll tell you, one of the things that I would say is that just to be safe, you can always say, I am one of the doctors here today. Right.
Right.
So keep it open, and thus you can never make a mistake about this point. Yeah.
Right.
Now,
right.
The second thing, you've got good news for that woman, and that good news is that the baby is okay. All right. There's no point at all keeping or holding that up from her until you're done with your questioning. If you have good news, just say it. All right. So I'm telling you, I'm really worried about my baby, doctor. And you asked me a few questions, and I came back to you saying, I'm really worried about my baby, doctor. Tell me the baby's okay. You don't have to worry about that. All right.
Yeah. Yes.
So I'm going to be relieved, and then I'm going to get off your back in a way, and then you can continue with your lines of questioning. You understand my point here? Yeah? Now, there was a repetitive question when you said, when did it happen? When I already told you that it happened this morning in the bathroom. So yeah, pay attention to that. Your inquiry about pregnancy was a little bit lacking. When you ask about pregnancy, there are a few questions that you need to ask. So basically, just to sum things up, when it comes to the lines of questions about pregnancy, you ask about the age of gestation, you ask about the progress, if everything is going okay, you ask about if I'm experiencing any sort of complications, and obviously you ask about the number of pregnancy that I've had before. Yeah. And when you ask about the number, make sure that you ask about the outcome, because in certain scenarios there might be a terminated pregnancy, for example, a pregnancy that didn't end up with an outcome.
Yeah, I thought she said she has a daughter, and the daughter is living with her, and she's fine. So because in terms of time, I feel like I'm running out of time.
I understand. I understand. I totally agree with you on this one. But just to be, like kind of sum up, what are the questions that you need to be asking about pregnancy?
100%.
All right. Now, in this kind of situation, someone is coming to you with bleeding. You need to kind of rule out if they have any blood disorders, if they're taking any blood thinners. Right. Now, we know that this is not the case, but it will be safe, because you are a safe doctor, to exclude those things. Yeah.
Right.
Okay. And I love the fact that the way you asked about family and friend support, that was amazing. Like, I really loved it. Like, you brought it up in a very natural way. I felt like it was a very natural question, asking me, did you talk about this to any of your family or friends? That was really well done. Now, when it comes to the partner and you suspect like there is some sort of a domestic violence, it's very important that you exclude the use of alcohol, drugs, if they have any criminal records, so that you get an idea about what kind of partner we're talking about here. Yeah?
Right.
These are the things that kind of stood out for me. Now, if you got those things right, then you're good to go. Again, I have no question about your interpersonal skills, about the way you hold yourself. And when you go to that examination, you will find out that it does make a whole lot of a difference if you have those right. Okay? Just focus for the remaining time on your medical knowledge source. Make sure what are the things that you cannot miss. And throughout your mocks with us, I'll make sure to highlight those things for you.
I'm so happy to hear that. I'm so happy to